Back blows and thrusts come first every single time. That has not changed. But after that fails, the answer actually got a lot more interesting in 2025. So as a pediatric ICU doc, I manage choking and airway emergencies. And as a dad, I panic bought the LifeVac after my first child was born. So let me give you the full picture. Basically, the AHA and the AAP updated their choking guidelines in 2025. The biggest change is that back blows are now the first line treatment at every age, whether it's babies, kids, or adults. It used to be the Heimlich or abdominal thrust for kids and adults, and back blows were just for infants. But now it's unified for everybody. So how do you do it? Well, for an infant at least, you want to use the heel of your hand between the shoulder blades in these firm, forceful downward motions. You're forcing air out of the lungs to push the obstruction up. So you're really kind of like inducing a cough. You want the baby's head tilted down a little bit. And if you're not a little worried that you're being rough or a little too rough, you probably need to use more force. Babies under 1, you do 5 back blows, flip them, and then 5 chest thrusts with the heel of your hand. And you can use your leg to support them if it helps. We're not using 2 fingers because it doesn't generate enough force. So kids over 1, you do 5 back blows and then 5 abdominal thrusts, which is more like the Heimlich maneuver, and alternate back and forth. If the child goes unresponsive, you need to start CPR, which is putting them on a firm surface and doing chest compressions immediately. When you go to give breaths, you're supposed to look in the mouth before breathing, no blind finger sweeps. Okay, so where does the LifeVac fit into all this? Well, basically the AAP and AHA guidelines specifically say suction devices are not recommended over standard back blows and thrusts. The evidence behind them is limited. One's industry sponsored. There's some bias concerns. But in March of 2026, the FDA granted LifeVac a new de novo classification as a Class 2 medical device. So it's the first and only anti-choking device authorized by the FDA as a second-line treatment after back blows and chest thrusts or abdominal thrusts have failed. So what do I actually do? Well, I do own one. And so if I'm at the point where multiple rounds of back blows and thrusts have not cleared the obstruction and my child looks like they're about to go unresponsive, I personally am going to reach for the LifeVac and I'm going to try it before I start CPR. Not the first thing I grab, but it's actually kind of the last thing. And also, just remember, it's only classified for children 1 year of age and older. So if you use it younger than that, that's kind of off-label. So the real takeaway, you need to learn back blows, you need to learn chest thrusts, and abdominal thrusts, and take a CPR class. That's the foundation, so that doesn't change. But the device in your drawer is a good backup. If you want a LifeVac, that's a reasonable call, but the skills come first, and it should never delay the standard therapy, either those thrusts, back blows, or CPR.